A British public health expert says the world should prepare for the worst-case scenario in the pandemic, that a successful vaccine never appears.
David Nabarro, a professor of global health, says it cannot be assumed that scientists will be able to develop a vaccine that is not only effective but also safe. Taiwanese Dr. Huang Li-min agrees. He says producing a COVID-19 vaccine may be a challenge and that countries need to be ready to coexist with the virus long term.
Amid a raging pandemic, U.S. President Donald Trump has claimed that a vaccine would be ready by the end of 2020. A UK public health expert isn't so optimistic.
So this virus, we think, is not going to go away, period. It's just we don't have a vaccine and we don't know how long it's going to take to develop one, and we don't yet have a treatment, and we again don't know how long it's going to take for that to come along. So we've all got to learn to live with this virus.
There are two requirements for a successful vaccine. It has to provide immunity to the disease, and it must not harm the immune system. So far, no COVID-19 vaccine has achieved both.
If you look at the two coronaviruses most similar to the one that causes COVID-19, the body only retains immunity for 2 years after infection. Then it disappears. So we're not clear on how long immunity lasts for the novel coronavirus. If it's just 1 or 2 years, it'll be hard to produce a vaccine that triggers a long-term response. Secondly, vaccines for certain coronaviruses can damage the body's immune system. If a new vaccine causes this kind of damage to the immune system, you can't release it to the market.
Creating a vaccine that provides long-term protection without harming the body are big hurdles to overcome for vaccine development. Some experts say travel restrictions and lockdowns may be our new normal.
After enough people in a given population are infected, the pandemic will subside. We might not have blanket travel bans in the future, but we may have to change our daily lives. The new way of life could involve long-distance learning, telemeetings, working from home, and so on.
Huang says full travel restrictions are unlikely to persist, but that life as we know it may be irrevocably changed. He says that rather than waiting for a vaccine, learning how to coexist with the virus may be a smarter option.